My name is Sandra Sanchez-Reilly, for whoever doesn't know me yet. And I'm a geriatrician and a palliative care physician. And I'm working with Dr. Monica Horton, who will be here in a couple of minutes, and Dr. Liliana Oaks. Dr. Liliana Oaks is from the Department of Family and Community Medicine. Lily.
Welcome everyone. I'm happy to be here. I'm a geriatrician like Dr. Sanchez-Reilly.
This session is a special session, and we wanted to thank the Hartford Center of Excellence in Geriatrics, and Cindy Alford is here representing the Center of Excellence. Please, Cindy, wave. For the food and just sponsoring this event. The idea of doing this is that we wanted fellows, residents, and other learners to be able to have fun with geriatrics and know that geriatrics is a good thing that can happen to you if you want to go into it. We are very happy to be geriatricians because we get to improve a lot of function in older adults and manage a lot of good symptoms and do a lot of good for all people. So the idea of this is that we're going to have fun today. We're going to answer some questions. Hopefully you get some key answers to the questions that actually you may have these questions on the boards. Welcome. We're just having some more people. I'm going to ask you to have some lunch and then sit, like you guys, you two, will you sit on this side? So in order that we're going to play geriatric Jeopardy. Who have not seen Jeopardy before? Could somebody explain? Okay, so the idea is that it's the same Jeopardy game. It's just that we're gonna do geriatric questions. You're gonna have Team A is here and Team B is over here. We're gonna have about the same amount of fellows on one side. Let's see. We have 4 fellows and 2 fellows here. 1 fellow needs to come over here.
You have an identity.
No, it's in the book.
I'm not playing, sorry.
How many residents of interns do we have here? Just raise your hand. We have 3 and 4. And how many residents and interns do we have here? You, okay. And you 3 and she's on the phone. Very good. Okay, Jane is there. Okay. Okay, I think it's pretty good. And then Larry, if you wanna, we have a graduate students here, so you wanna stay here. And if you wanna have some lunch, please do it before. Okay. You wanna stay here? We need you divided into groups. Right. So I'm gonna have you guys pick one speaker, and only that speaker is gonna talk.
Yeah.
Who's gonna be, I don't know, you guys decide among yourselves. So we're not going to listen to anybody else but that person, and that person will raise their hand. Okay, you a speaker? Do? What about you? Do we have a speaker here? Elaine? Okay. All right. So everybody please identify their speakers. Sam here. Sandra, please. Okay. And Elaine over here. Yeah. Okay. So that's Team B. Okay. Now, when the question comes up, the first. Okay. When the question comes up, the one that is going to be playing the first. We're going to be adding points or resting points according to if you answer correctly or incorrectly. So you may end up being minus 5,000. So be careful before you raise your hand. Right. Be your hands. You read the question, you raise your hand. You have 20 seconds to discuss it with your group. Okay? And then to give an answer. If your team is unable to give an answer or don't want to give an answer, no points will be rested. Will be yes, subtracted from the team. But then the other team will have the chance to respond. So 20 seconds, okay? Any questions? No questions?
No, we're just
all right. So we're gonna have fun, okay? So let's try.
now?
Okay, we're ready.
First.
So categories are the elderly, aging and prosthesis, under pressure, it's all in the numbers. I walk, therefore I am. World, backwards, crazy for you, boohoo, pain go away, and potpourri. And I guess I'm gonna. Somebody have a coin?
Yes.
Anybody has a coin to start?
It's Janet.
Okay. Thank you. All right. So what do you want?
Tails.
Tails?
Yeah.
So who's okay?
We do. Well,
Category. You can.
want to be crazy for you. What category, guys? What do you guys want? What do you want? What do you think? Crazy for you? Crazy for you?
Okay. The speaker spoke. So crazy for you. And what number do you want?
How? Let's do 200. Crazy for you.
Crazy for you 200.
Crazy for you 200. It goes.
And it goes 20 seconds. Dun, 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 dun. No, they did first. They did.
Okay. 20 seconds. We need to raise our hand.
Okay, 20 seconds are up.
So we need to talk among ourselves.
We're gonna read the question. Delirium in hospital.
They have to answer.
No, because they raised their hand.
Oh.
It's where
D.
you answered D.
Yeah.
Okay. And your answer is
What is your answer?
D. Anyway. D. Okay. Well, you're not gonna count points, but if they fail, then it goes to you. So the answer is no.
I did it wrong, sorry.
So why? Could you explain why is the answer? Guys? Yeah, but definitely. So the fractures because delirium results in increased mortality, increased length of stay, institutionalization, dehydration, deconditioning, immobility, neurosis, and isolation. Do you have any questions? No? Okay.
What I will that is it potentially can increase the risk of falls, but not directly the fractures. So it's a different consonant. Some people can get fooled by that. Okay, good. The little house. Yeah.
Okay, you guys won, so you get to choose.
Alright. Good. Quickly, you guys. Yeah.
Which one?
Which one, guys? Did you decide it?
Let's do aging age versus disease. Okay, but we're only listening to the speaker. So that's who I'm talking to.
Let's go to Boohoo for 400.
Boo-hoo for 100?
400.
400. Wow. Yay!
Boo-hoo for 200?
400.
Oh my goodness. Okay.
They're going for the money.
And the question is, disorder with ECT is first line therapy, electroconvulsive therapy. And they raise their hand.
20 seconds. Discuss among
Dun,
yourselves.
dun, 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 dun.
And why?
Do you have an answer?
Yeah.
Okay. But we have to get something next time to like make it. Yeah, buzzers. Okay. What is depression? Okay. What about your answer? They say what is depression?
Refractive major depressive disorder.
Refractive major depressive disorder. Okay, it's 400, right? And what's the answer?
Major depression.
Ooh,
Yeah.
sorry, which should I give you?
Sorry.
Okay.
It really is.
So in that case,
So in that case,
we got it.
no. Bob, you say major depression.
Yeah.
And you say, what do you say?
Oh, okay.
You say major depression?
Refractory major depression.
Right, but one of those options is.
Well, that's the same thing as major depression.
So are you picking major depression?
EMB. Okay.
Major depression? Okay. So you bought lost because the answer is psychotic depression. So actually it's the only indication what is refractory or what is psychotic, but the refractory option wasn't there. So
That's the question they always ask.
okay, let's go to minus 400.
But it was first line.
Let's go to the next category. And because you did, I guess it goes to you. No, because they did you guys?
They failed it.
When
They
we
didn't
lose,
answer.
it goes to the other. Oh.
So you chose a category.
It stays with us.
So,
But no, you guys, you go.
we need to go.
Yeah.
Okay. Where?
Somebody raised their hand.
Yeah.
Quick.
Hurry up. We don't have time. What do you need for sissies? Pain. No? Pain or repeat?
Quickly.
Okay.
Okay, we go with pain and go 500.
Thanks. Oh wow. 500. And the question is the 3 most useful classes of drugs for treating terminal dyspnea are, and you get to choose one of the options.
20 seconds, right? This was on your A, B, C, or D.
Nobody knows? I don't see any hands.
Okay.
Okay. They raised
They
the
did
first.
Can we say the answer? C.
C? Okay, so they're saying benzos, barbiturates, and opioids. What are you guys?
C.
You say C, which is the same that they
No,
say.
B, because if they, we don't know, if they get it right, we don't know.
Oh,
okay,
okay, fine. Yeah, right. B, you don't. You say B? Okay, and the answer is C. Very good.
Yay.
So in terminal dyspnea, you can use benzos, you can use opioids like morphine. You have used this before, and barbiturates at the very end if nothing else has worked.
All right, crazy for you, 400.
400. Crazy for you. Or irreversible risk factors for developing delirium except. Okay, Tam. Okay, your group. You have 20 seconds.
Okay, let's discuss.
You guys have 20 seconds too, so you better discuss it. D, E4. Do you have an answer?
You can just read.
For dementia, Larry, that question?
No. What are irreversible? What is reversible?
Hey.
It has to be D.
Irreversible.
This is working. Ooh, it's the commercial now. Oh, that's really cool.
Sarah 12 for the motion causing and for spirit also. Because we have some dementia. Committed to your own.
Ready? Are you all ready? All right, we should give a round of applause to our prize. Okay, so we're going back. I think the team B is winning big time. No, yeah, team B is winning. So, come on, guys. Well, I'm sorry. We go back to this question. What was your answer? D. D. And you guys?
D.
D as well? No.
Okay.
Okay.
What do you guys say?
Okay. B. Have you said B? Okay, let's see. D. So risk factors include dementia, structural brain disease, and age. You know this. So this factor for the
Risk factor.
But what?
That's not well, that's a trick. It was
You were right?
No.
Okay.
Yeah.
We're working right next time.
Okay, please. We're taking note, guys. I will take a minute.
Okay, let's go back to categories.
Okay, but guess what?
But guess what? You guys. So come on. Just because they say that the question wasn't right, so I feel bad. So come on. Okay.
Go to 8.
Okay, world for 300.
Okay, and the question is, generally in a treatment for agitation outside music, carbamazepine carbated at 2 to 3 milligrams a day, carbamazepine or haloperidol 0.5 to 0.75 milligrams a day. Dun, 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 dun. Okay, team A, C, carbamazepine milligrams a day. What about you guys? Milligrams a day. And the answer is D. Actually, because 0.5 milligrams of not really black placebo, it was demonstrated. So you actually more than that. So that doesn't. You have to be very careful. I don't want it to be kind of how to everybody with this here. But actually demonstrate any specific effects over placebo.
What's B? What is it?
Oh, cognitive impairment.
Behavioral.
And behavioral problems related to Alzheimer's.
Yes,
I would still argue
that's what they said.
that you start low and go slow.
Right.
Whatever that effective dose may be.
Right, but 0.75 for haldol is really very minimal dose if you're talking about PO.
Well, I didn't say.
Okay, let's take notes then. We gotta
I took note of that one too.
okay. Next, again. Who lost? You
We
guys.
did.
No, you did. So now you get to choose.
Which, okay. Let's try under pressure for 200.
Under pressure for 200. And the question is, potentially harmful treatments for the pressure ulcers include all the following except no debridement, dry scar or heel ulcer. Remember, it's except abdominal ring cushion, soft tissue massage of betadine on infected wound.
Oh, okay.
Okay, you guys.
D, you ready?
D.
No, stop.
Also,
B. I'm a
B.
foreigner.
Abdominal ring cushion. Okay, B. What do you guys say? Remember, include all the following, potentially harmful, except.
Oh, sorry.
A. No, you already say B. Okay, what about you guys? C.
B.
B.
Scar you should.
So you say B and you say B, right? You sure about that?
Yes.
Reread the question.
Because we had so many separate.
They are bad.
Potentially harmful treatments in pressure ulcers. Now this is just for information. All right, and the answer is C. What? C. What's the answer? Lily.
Oh, okay.
I think. Lily, answer. What's A? So not the bright, because remember, everything else was not helpful. So the donor wasn't helpful, betadine wasn't helpful. The breathing at dry scar, we usually don't do it on a heel. So this was the only one that was actually that was actually the correct one. Except none. All right, so you guys, any questions? Okay, you guys get to choose again. Elaine, you guys get to choose again.
Oh, let's do boo-hoo for 200.
Boo-hoo for 200. And the question is, most successful at suicide in the United States? Tom. A. What do you say? A. Okay. Okay, so absolutely. Yeah. So white males more than 60-year-olds, they're higher rate. And you're going to get these on internal medicine boards and step 3 and F.
Which one?
Oh, no, sorry. We were going to talk about that. You want to go inside?
Okay, before we go, change the speakers, please. So we get to rotate. So who wants to be a speaker here?
Jenna's good.
But no, what about residents? Yes. Vanessa, okay. Which one? Okay, Vanessa. So which category?
Crazy.
Okay, crazy for you. Crazy for 500.
Good luck.
Positive screen for delirium using the CAM or confusion assessment method. Oh, we did. Did we? Did you raise the first? No. No, you raised the first. Yeah, you raised the first. Okay, go ahead. What's your name? I'm sorry.
Jake.
Jason. Okay. Okay.
Yeah.
Okay.
You guys have 20 seconds.
Create for your positive screen for delivering using the assessment method.
What is A?
Okay, he answered what is A. What about you guys? What is A? Vanessa, what do you say? They're saying A.
Oh, okay. I said no. It's
You saying A? Okay, yeah, you're right.
A. Oh, sorry, Julius.
A. Yeah.
Okay. Okay, so what is saying? You guys get the point. So acute onset, inattention, disorganized thinking. I'm sure you all see patients with delirium in the hospital. And to CAM, it's called the confusion assessment method, and it's pretty much the most reliable scale we have to measure delirium in hospitalized patients. It was created in Yale about 10 years ago.
Okay, E elderly for 500.
Totally for 500. And the question is, the cause of dementia characterized by memory loss, ataxia, nystagmus, and ophthalmopsia. Vanessa, okay.
Oh, I'm sorry. I did it wrong.
That wasn't big money.
I'm sorry. It was my fault.
Okay, so I guess it's not counting. I'm sorry. Oh. Okay, well, but you get to choose. You get to choose.
No.
Agent persistence, which 500. Okay.
Oh wow.
Agent persistence 500. The finding that is not consistent with normal age associated change. No, but you need to put the options.
There we go.
Okay. Yeah, but Jason is the one raising his hand and he didn't.
But he raised his hand.
He raised his hand first?
He did.
Okay, I'm sorry. Okay, so which do you need time or 20 seconds? Okay. You guys, time is up. What's your answer? You can pass if you want.
See?
Okay, how about, what is D?
What is D?
Yeah.
You're saying increased post-void residual. What are you saying? What is D? D. Decreased bladder capacity. Let's see. What is E? So it's not consistent with normal age. So decreased urinary flow rate. You want to? I think it's an explanation for that. Is that a relation? No.
No.
I didn't see
Who chose that? You guys? They did. So and that was 500.
Shall we choose?
Yeah.
No, they choose because you choose the aging for season.
No, but they lost.
They lost. Oh, okay, yeah.
So
So
you
you
get
get
to
to go again.
Go ahead.
Okay.
For 500.
Which one?
For 500.
500. Okay. The prevalence of the 3Ds among older adults in decreasing order: depression, dementia, delirium; dementia, depression, delirium; depression, delirium, dementia; delirium, dementia, depression; dementia, delirium, depression. Okay. You guys raise your hand. Are you ready, or you need more time?
In decreased order, you said?
It says the prevalence in decreasing order. A. Depression, dementia, delirium. What about you guys?
Oh, they did already.
They said A? Is that what they said?
They say A.
So it's your
Yes, I
turn.
thought it was still C.
I say B.
You say. So Jason, what do you say?
B.
B. Dementia, depression, delirium. And the answer is. What is A? Depression, dementia, delirium.
Now we want 100.
So this is just to remind you that depression is common in the elderly. Up to 40% of all older adults experience depression. So you should not misdiagnose it in the clinic because they present to you in the first place. So you guys are. This is close. How much was it?
500.
But it's more frequent the depression than delirium if you compare the two entities.
No,
Depression is more.
no, but then the way they were being mixed.
It was depression,
Dementia,
dementia.
delirium.
Well, that's what I'm saying.
Right.
That it's because it's not identified and
It's possible. Right.
recognized.
Right. Right. And you have a delirium underlying dementia underlying delirium. So.
So we're doing
Choose
it.
who you guys to choose.
Walking there for you. 500%.
Walking, wow, you guys are right. 500. Walking, I walk there for I walk there for I am. Demonstrate the proper use of a cane going upstairs. Going up the stairs. So,
Go, please go.
of a cane. Unfortunately, I don't use a cane. But you wanna demonstrate it? And we're gonna need a representative from you guys. Okay. I don't have a cane. I'm sorry. I forgot.
So let's see, say I have a single point cane using my left hand and my right side basically.
So your bad leg is your
left side.
Left side.
Right.
So you're carrying the cane on
my right side.
your right
And
side.
I'm going to use the single point cane
Uh-huh.
first, and it's going to be up with the good and down with the bad. It's the first step. I'm going to. Wait a second. Up with the good and down with the bad. So the first step I'm going to take is with my good leg, like so, following the cane, and then my bad leg follows.
Okay, very good. Anybody else other suggestions? Okay, very good. So remember, just for you to remember, when you use a cane, you usually have to use it in the other side that is not your bad side, so your good side, because you're supporting yourself. And then when you go up the stairs, you go to heaven. So the good goes to heaven. So remember that, okay?
So when you go down, you
Right.
in the back of the house.
And obviously the bad go to hell, so down. Okay, so 500 from them. Yay. 500. The recommendation and the use of iodine, acetic acid, hydrogen peroxide in the treatment of ulcers. Do you have an answer, or do you need?
Well, what are the options?
Do we have answers? I can take it again.
I think we have answers.
Hold on.
Oh, we messed up. Sorry.
I'm not here. I'm like, what's the options? All those things are bad.
She said the last
I said don't use any of them.
You did?
I did.
I did.
Everybody hear me?
Did you hear her? Yes. They get 500. She raised her hand first.
She raised her hand before the.
Okay, so you guys.
We need Michelle looking both sides because it's going to be really hard.
Right.
I can see that
Yeah.
everybody
And Monica is there too. She can tell.
So you guys check. Okay, so choose again.
Okay, choose again, Dave.
Choose again?
Yeah.
Jane, yes.
Strike that 500.
I walked up over here.
I walked before I am 400.
No, okay, 400. Okay.
You did the.
No, that's.
Oh, 400. I'm sorry.
I know that one.
I walked there for I am for 400.
Demonstrate the proper use of a cane. Okay, and you raise your hand. Oh no, but yes, you are. Yes. No, you have to do it.
I am.
Yeah.
The other one is moving upstairs. This is
Oh, this is just.
And just-
I see.
You have to
Demonstrate
A
the
little
proper
bit
use of a cane.
put the hand from the
You have 20 seconds if you're ready.
20
If you're ready to do
seconds.
it.
He's
Okay?
on his way.
just that, and then
Put first and the cane. I don't want to do it.
Okay, you want to do it.
Yeah, but then I don't know. Good foot and then the cane.
Olga, do you want to do it?
She can do it.
No, he said I have to do it.
Okay, Robert, come
I
on.
don't know what that one.
Up with the good, down with the bad.
So, this leg is bad. So I got my 1-point cane in my right hand,
Uh-huh.
and I'm gonna go like this. Good, and then cane, and then.
That's good, but I need a little bit more information.
Oh,
Like
yeah.
how high the cane should be and how many degrees. Can you help me with that?
Other 20 seconds. Go back and talk to your group. 20 seconds.
What?
The details of the case. Yeah, he can. Can I go? Give him a second.
Okay, so then I have a second chance.
the opposite side of the leg that
Okay.
is affected.
Okay.
And then the height of the cane should be above the trochanter.
The greater trochanter. Okay.
And then what you do is you go with the bad leg and the cane at the same time.
Okay. Sounds good, right? Yeah. Okay. So the other way of measuring is about 15 degrees from this here. What do you call it? Stylus. Yeah. And 15 degrees away for 400.
Yeah.
Okay.
Anything away from 400.
Oh, you better know this one. The equivalent IV dose of 15 milligrams of pure morphine.
You finished it before you finished the question.
Oh, you're right. I didn't finish the question.
She finished. I raised it.
Speak. Speak.
Okay.
It's 3 to 1.
Yeah, B.
What?
What is B? 5
What is
milligram IV
B?
morphine.
5 milligrams of IV morphine. What about you guys? Same? B? Okay. The answer is? Okay. So what is B? 5 milligrams of IV morphine. You know that the equivalent is to feel money, right? You better know this. Okay. Next. So you,
So what's on the board?
Let's do potpourri for 4.
potpourri for 4. I have to finish the question, remember. The most significant risk factor for preoperative mortality in the elderly. Urgency of the procedure, advanced age, chronic disease, and type of anesthesia.
It was simultaneous.
It was a tie. They both went up before you started your
Okay, so I'm going to give points to both if both answers it. So
Okay.
let's see, Jane. You have 20 seconds, by the way.
Okay.
Can you just use procedure?
You're going to go with A. So what is A? Okay. What about you guys?
A really does matter. A is a big thing. If they do it in the operating room, it's like 50% mortality. I think it's A. But is that they said too?
We said A.
But we both can get points though.
Yeah, you can get points.
Let's say A.
What are you going to say?
A.
A. Okay, very good. And the answer is?
Yes,
Of course. So urgency counts above anything else. Age is not really a risk factor. What's that?
Potpourri for 5.
No, it's already been done.
Potpourri for 500. Potentially reversible form of dementia.
Tie it again?
It was a tie again.
Potentially reversible form of dementia. P12 level of 215 with elevated methylmalic acid or elevated homocysteine. What do you guys say? C. Say C as well, okay? What is C? Very good. So remember, 11% of all dementias are potentially reversible. That's why we do the workup for dementia. So we usually, what is the workup for dementia? What else do we include? J.
B12, TSH, RPR.
RPR, we don't necessarily include them on everyone unless they have risk factors, because if we have a positive result, then we're going to have to do an LP, and it's very difficult. But it depends. Sometimes we include them. Do we do a CAT scan? Looking for what? Not always, but if we do a CAT scan, what do we look for? I'm sorry? Infarcts? Normal pressure, hydrocephalus. Absolutely. Anything else that we should do on the workup? TSH? Well, did you mention it? And then we should rule out the pressure.
Can we do, let's do the numbers.
Yeah, numbers.
Numbers for 4.
Which one?
It's all in the numbers.
It's all in the numbers. For 400?
Yeah.
The percentage of hospitalized elderly patients being discharged from the hospital after a cardiac arrest is? Jane. You have 20 seconds.
Okay.
My team should know this, but
A.
you have A, less than 2%. What do you guys say? A. What do you say? A, less than 2%. So that's correct. Less than 2%.
I thought it was that much.
Is actually the one who What that means is that they won't leave the hospitals. They will go to a nursing home or something, so they will not go back to their base.
Are you gonna write something?
Yeah. No, you all get it right.
What do you like? Go for it.
Choose.
I'm good. 500. Where? It's all in the numbers. 500.
500 is all in the number. This is a tricky one. Okay. The percentage of long-term custodial nursing home costs reimbursed by Medicare. Who raised their hand? Well, you both get to answer, so. The percentage. Okay. No, there are no choices.
There are no choices?
No choices.
Okay.
The percentage of long-term custodial nursing home costs reimbursed by Medicare. So remember, there are different categories for rehabilitation. If you have subacute rehabilitation, Medicare reimburses 20 days. That's why if your patients have Medicare and you get a consult from ECTC and I get to answer it, I usually send you to a nursing home if they have Medicare. But for custodial care, Medicare would not pay for any custodial care. Zero. Okay? So that nursing home is either paid by the VA or is paid by private pay by their families or is paid by Medicaid. We get to choose now. You guys. I know, but they won, so they both get
World backwards for 5.
We're back up for 500. Okay.
World backwards.
Oh, we're backwards.
Demonstrated by randomized controlled trials to have no treatment efficacy for Alzheimer's. So, okay, do you have an answer? Do you guys have an answer?
I think it's really.
So it's demonstrated to have no treatment efficacy on Alzheimer's.
First trial. No, what's it called?
The wind is
Women study vision and also the new data. I don't know how updated that.
It's updated.
It's updated.
Okay, so you have an
That's
answer?
a question. Randomized clinical trial. Do you think they have done a randomized clinical trial?
They say C.
Yes,
Okay,
yes,
guys,
yes.
time is up.
It will be D.
You're saying B? Estrogen? Okay. The answer is estrogen. Estrogen, I don't know if you have read the HRSA trial, but estrogen has demonstrated not only not to have treatment efficacy in Alzheimer's disease, but also to increase the risk for cardiovascular disease.
Reason two, data ginkgo biloba in European trials.
Yeah, they did. Ginkgo biloba is very important.
Supervise the doses there, but the FDA in United States, because they don't have control of what they put, is not. So you will find also controversy about that in terms of the ginkgo biloba.
What about the vitamin E? We do have randomized, not here, but we do have it in Europe, randomized control trials.
That it helps?
That 800 units a day.
But again, it's an over-the-counter. So here in United States, nobody can guarantee how much vitamin E they put on that. Like the
I think that question better than more points.
yeah, that's
Yeah, that was a really good question. That should have been the W for second.
Okay, let's see. Okay. Well, choose
Jane, 400.
And we
E of the elderly.
E for the elderly? Okay, good job. Brand name of the drug shown to decrease bone turnover, improve liver growth, and not stimulate endometrial proliferation. Okay, what do you guys say? I'm gonna give it 2 votes. So
I don't think we have answers on this one.
no.
It starts to eat.
Okay, time is up. Can we
The
have
Vista?
Yeah.
Yeah.
What do you guys say?
Vista.
Okay.
So relax. You know that. Okay, then.
They were saying the brand. Pain go away, 300.
300. Pain go away. Let me read the question. A short-acting opioid avoids elderly due to accumulation of its metabolite leading to CNS toxicity. Raise it first, okay.
But not.
What is it? Meperidine. You all know this. Demerol meperidine is a no in the elderly. Do not use it. The metabolite.
It stays, hangs out there.
So it's about 12 to 15 hours they have life, and it has effects such as seizures and different myoclonus. So do not use it, okay? So you get, how much was that? 300.
World.
Which word for 400? Okay. I have to read the question first. It presents with dementia, rigidity, and early onset delirium. Visual hallucinations but no myoclonus.
We're gonna show the guys.
Elliot.
Lewy body dementia.
Lewy body. What about you guys? You say Lewy body too?
Sorry. That was my fault. It was world for no. Yeah.
300. Oh no. Was it 400?
And a commercial, you know.
Yeah. You wanna look at the prices again? Yes, you know that. Lewy body dementia. So they have increased sensitivity to neuroleptics. Remember that.
Can we do all of them or is that
No, I think that we probably gonna
We
have
should
to.
wrapping up.
We
yeah.
should. You
What's
should have
our
wrap
score
up.
so far? So we
Let's
got
have the last
final
question.
Jeopardy where we
Let's
wait how
have
many.
the last question. We wanna pick the last question.
Yeah, we should, I don't know which one is the
Oh,
delegate.
that's what I'm saying. We have to know how much points we have.
Yeah, I'm gonna do that, but in the meantime, we got a question. So say, I don't know, age emphasis for her. The most appropriate behavioral technique would put stress in context.
Oh my God.
Elliot, you raise it first.
I guess.
Yeah, that's what it is.
What are Kegel exercises?
Kegel loves behavior. What about you guys?
No, but I think you could
Oh, you
couldn't do your bladder.
Yeah.
You can put it
That's your bladder training, that's another concept.
Because I was thinking of
biofeedback. You were thinking in the biofeedback more. Yeah, considering
Oh boy. So team A got 3,500 and team B got 3,400. Who won the prostate?
Beautiful. What do you think? We all enjoy it.
Here, I'll take it to the
See
news.
everyone's.
But we have
You guys take the prizes.
prizes.
Yes, but you can give consolation prize. Give them the Celebrex pen. We really, really thank you for coming. It's really nice to have you here. And we hope to do another session really soon. If you are thinking of, guys, if you're thinking of going into geriatrics or interested in here in the fellowship, guys, we have some applications here for the fellowship if you're interested, or if you're interested in geriatrics, either Monica, Liliana, or me about what does that mean and what are the applications of geriatrics. So
We're also going to have a recruitment party in June, and we're thinking in La Valencia City through an email. So you spend the time today, give the email address to Monica or Sandra, so you will get the invitation and have priority for the recruitment party. Excuse me, so you can talk to us about it.
do you have any questions or suggestions or comments? Okay, just grab your prizes. You
Thank you for
coming.
Thank you.
That's what I'm putting out
We gotta go to bed already.
there.